Perhaps you came across an ad that says you can do this test for $100 and it has 100 biomarkers, all the details you need, in-depth testing that's going to give you a lot of information about your health. Biomarkers, lab tests, studies, data, these are incredibly important to me to come up with an individualized plan for my patient. Now, I had a chance to go through some of these ads that my patients and my team here at drashori.com sends me, and we went through a few things together to just kind of see, is this information really good information? Is it actionable information? Or is it just a bit of noise? What I ask myself before I order any test is, what information am I exactly looking for? What action am I going to take based on this information? And is the outcome of that going to be meaningful to my patient? Unless the three things are actually covered, there's no reason for me to get further testing done. The first thing that is included usually is always cholesterol, a very in-depth heart and vascular health biomarkers. And here you can see that there are a lot of different tests to check for cholesterol particles and different types of cardiovascular risk markers. The reality is, even more important factor in overall metabolic and cardiometabolic health. In the past, we used to think, well, it's just your liver. We just don't want it to fail. But now we're realizing that a good, healthy liver actually means you're probably also at lower risk of diabetes, lower risk of heart disease, and low risk of cancer because of the inflammatory markers that the liver is in charge of. The next section is the kidney health biomarker. And what I thought was interesting here is that they repeated some of the things. So for example, they're getting a creatinine test and then they're mentioning the calculator estimated glomerular filtration rate and BUN. These are all tests that come in a very standard blood test already. And most of the time, again, they don't give us a lot of information. I have other videos on this channel regarding kidney health that you can review. But when it comes to kidney health, we know that blood pressure and blood sugar are the two most important things that you can do to prevent your kidney from ever developing damage, from ever needing dialysis, or needing a kidney transplant. While I think these tests that they have mentioned here are good, probably the most important thing that I need is somebody's glomerular filtration rate. And in fact, a test that's missing here is the Cystatin C, which can sometimes be helpful for certain people who take a lot of supplements or who exercise a lot. And so for them, we can't often get a good creatinine function kidney test. And so we switch over to Cystatin C. The next section here is the sex hormone biomarkers. I think these are really, really helpful when we're worried about maybe a woman in perimenopause or menopause or a man with hypogonadism. The problem with relying on these biomarkers is that it's much less important what these tests show than what my patient is actually telling me. If a woman with perimenopause is already starting to talk about joint pains, joint stiffness, frozen shoulder, difficulty sleeping, mood, energy, focus and cognition, there is something probably going on with the hormones. Now, sometimes it's something we can fix with lifestyle changes, but sometimes we have to consider an estrogen patch, progesterone, and for other reasons, even testosterone. So it would be less likely that I would rely on these tests and much more likely that I would rely on the symptoms first and then go after very specific tests based on what my patient is experiencing. For men, it's a similar process. If they're losing some hair on their body, if suddenly all their acne goes away, their back acne, which a lot of men still have in their 40s, if they're not able to sleep well, their mood, they get depressed, or they have very low stamina, sex drive, those are reasons to consider hypogonadism in a man. And a blood test can be helpful. Again, you really need to do the right tests. I've talked about in other videos and my articles on Substack that you can't rely on cheap tests. You really have to get the proper tests where you get the sex hormone binding globulin, you get the total testosterone, free testosterone to really know what's going on with the patient. When it comes to thyroid health, is a more complicated condition because many people can have a very silent hypothyroid state. The question is, should they get a replenishment of their thyroid hormone? Because thyroid hormone has a lot of side effects with the heart causing atrial fibrillation and bone density problems. And so we want to be very cautious in individuals. Just because the TSH is going up doesn't mean we should always resort to replacing somebody's thyroid. And if we do replace somebody's thyroid, do we do it with T4, which is levothyroxine, or do we need to add T3? And these tests don't always give us that information. So while I think it's really good to do a deep dive in your thyroid function test, it's not always enough to do just a random screening test, because chances are one of these numbers is going to be off, but it may not mean that you have to take any action. The next section we have here, which is one of my favorites, is metabolic health, as in metabolic health is my favorite, not this section. The biomarkers here are pretty standard. We got blood sugar tests, we got hemoglobin A1C, we got insulin tests. And I think these are helpful, but for most of my patients, I can glean what their metabolic health is just from their lifestyle. By knowing what they're eating, how much they're exercising, what their stress is like, how much visceral fat they hold, what their body mass index is like, I can get a good idea of their metabolic health without even resorting to some of these more detailed tests like the cardio IQ test and the uric acid and triglyceride ratios. A fasting blood sugar and a fasting insulin are very helpful. Something like a ALT, which is the liver test we just talked about, can also be a great way for me to figure out if somebody has any early signs of metabolic disease. I can get somebody's triglyceride to HDL ratio. So these are things that I can do without needing to go and do a very deep dive, because if my patient's lifestyle isn't already optimized, testing wouldn't change my recommendation. I would still say we need to improve on your sleep, on your stress, on your exercise, on your nutrition. So doing more testing is likely just going to cost more money and maybe even muddy the waters, but it wouldn't change my recommendation. The next test category here is called nutrient biomarkers. And they're talking about what we would normally call a CBC, or a complete blood count, where you get your hemoglobin, neutrophils, and white blood cells. And those can be helpful, but as a screening test, they tend to cause a lot of headaches in my patients. Elevated eosinophils, elevated basophils, elevated MCV, a slightly low hemoglobin. And when you get those results, you end up ordering many, many more tests that don't really change the patient's outcome. So I'm very wary of tests like this. And in this same panel, for nutrient biomarkers, vitamin D, vitamin K, vitamin B12 levels are included. The problem with it is that the test itself is not going to give us a lot of information. And we have data now to show that just because we replace somebody's vitamin D with a pill or capsule, they don't have the actual benefit of somebody who replenishes their vitamin D through diet, exercising outdoors in the sun. And so again, my advice would still be the same, and these tests wouldn't change my advice. Therefore, they would be of little value in the average patient who is doing this as a screening test. The next category is inflammation. Of course, inflammation is at the heart of cancer, diabetes, kidney and brain health, such as dementia. And I'm always ready to do any kind of inflammatory test, but I always ask myself, does the patient have signs and symptoms of inflammation? Brain fog, fatigue, crashing at 3 p.m., waking up multiple times at night, acne, inflamed rosacea, inflamed psoriatic patches. If I check somebody's inflammatory markers, it would only be to maybe help confirm that, hey, we have some inflammation, or to track and trend the inflammatory marker. What I wouldn't do is check this many different types of inflammatory markers, because it makes it complicated to track them all in the future. Any test that you perform, you have to test again in the future to see, is this changing? Is it not changing? And that's what I talk about in my trend method, where T stands for testing. And we always make the changes in the lifestyle and the habits, and then we go back to testing. So if I were to repeat all of these again, it would be difficult to know what action changed which of these biomarkers. I won't go through all the other sections that are here, but I will tell you that some of these sections, like your actual biologic age, they've been proven wrong for so many different companies that have created these. And so the value in getting them done is very low. And they have other things like folate and ferritin, which I think are important tests to do for somebody in whom I suspect some sort of malnutrition. Again, looking at somebody's diet should be more than enough for a competent nutritionist and physician or dietitian to know whether somebody is having any nutrition problems. So my final takeaway is that a test like this, an annual repeated test of 100 plus biomarkers a year, is probably going to create more confusion, and it's going to cost you a lot more money in the long run, as opposed to focusing on the things that are most important. And once you do these things, when there is still a problem after doing everything right, if there is brain fog, stubborn weight gain, if there is severe fatigue or exhaustion or low energy, then the goal is to focus on those things individually and pick the right biomarkers to test and track.